In the last few days, we have identified and confirmed 5 cases of H1N1V influenza, which is the technical term for what people commonly call swine flu. 2 of these cases have been hospitalized, and they're in intensive care. Both of these are women, and one of them was pregnant. As you know, this particular disease carries a high risk in pregnant women. The other thing that I want to add is that all the 5 cases are members of a family, so we believe it's a family cluster, and therefore there isn't a public health impact to the rest of society. The other thing I want to tell your viewers is that the 2 women in hospital are stable, and we are seeing some early signs of recovery. So it's still too early to say that, but we are seeing some encouraging signs this morning.
Obviously, when news like this comes out, it does raise concerns, but just how dangerous is swine flu?
Well, any influenza is serious because it can cause, it can make you feel very ill. However, the swine flu is overall a relatively milder form of flu than the flu that we used to get in the old days. So overall, the principles of management and treatment of influenza is much the same, and the advice we give to the public about taking bed rest and taking warm drinks and staying in the house and disposing of your tissues, all this advice is exactly the same for this influenza as for any other influenza. The only difference is that in a small number of people, this influenza is exceptionally nasty, and that is particularly pregnant women and certain people with pre-existing illnesses like asthma, diabetes, cancer, heart disease, and so on. And for these people, we particularly recommend vaccination. So my advice to all pregnant women in Gibraltar particularly is to make sure you're vaccinated, and to those people who have these pre-existing illnesses, please go and get your vaccine as soon as possible.
There has been an upsurge of winter flu over the last couple of months. Has it been worse this year?
It has not been worse this year at all. In fact, the number of cases that we've seen overall are no different to what we've had in past years. And in fact, there have been years which have been far worse than this year. The only reason that this has become very newsworthy at this moment is because of this cluster of cases in one family. But otherwise, a few cases here and there would not be unusual for this time of the year.
So what advice do you give those who might be feeling flu-like symptoms?
Yes, as I said earlier, we would advise people who have flu and flu-like symptoms to treat it kindly. Bed rest, plenty of warm drinks, stay indoors so you don't go around infecting other people, and by and large, that should help you. Again, to prevent infection, make sure that you sneeze or cough into a tissue and then dispose of that tissue carefully. Those are the sort of things that you need to do. You don't really need to see a doctor most of the time because in any case antibiotics don't help with the flu. However, you need to see a doctor only if your condition gets worse and is not responding, and then you might need to see a doctor. But otherwise, generally, self-help is the best help.